I am Dr. Geeta Devi, Professor of Medicine, SRM Medical College and Research Center, and now I am going to present you the clinical features of chronic obstructive pulmonary disease. By definition, chronic obstructive pulmonary disease is a disease characteristic of airflow limitation that is not fully reversible. The airflow limitation is actually both progressive and associated with an abnormal inflammatory response of the lungs to noxious particles or gases. How we will consider the diagnosis of COPD is, for chronic cough, it is presenting with every day the person presents with cough and with chronic sputum production, and acute bronchitis is with repeated episodes, and dyspnea is progressive and it has been persistent throughout the day, and it is worsened at night, and it is worsened during the respiratory infections. And history of exposure to risk factors like tobacco smoking, cigarette smoking and chemicals, all those things will add on to the occurrence of COPD. What are the clinical features? While considering the clinical features, in the early stages there won't be any findings at all, but looking at the patient will be dyspneic at rest with the accessory muscles of respiration acting, and he will not be able to complete a sentence fully with the pursed lip breathing. And on examination, patient will be having a barrel shaped chest, and he sits in a tripod position, and there will be a prolonged expiratory phase and wheeze. And on examination, patient will be having the inspiratory increased decline in the intercostal spaces, and there will be a predominant emphysema in the case of pink buffers. And in the case of blue blotters, it will be a case of chronic bronchitis, and there will be signs of right heart failure like pedal edema, and there will be a sign of increased or accentuated pulmonary second heart sounds if they are going in for cor pulmonale. So these are the pictures of you to consider that it is a case of COPD. Here the person is sitting in a tripod position, and he is having a emphysematous chest with a barrel shaped chest, and the accessory muscles of respiration acting. And here, if you are talking with him, he will not be able to complete a sentence, and he may be having on examination, pulse examination, he may be having pulsus paradoxus also. Thank you for your quiet listening.
Super.